Alright, so want to quickly look at some imaging scenarios. Okay, so want to actually look at the axiolateral imaging of the hip. So for the axiolateral imaging of the hip, we get to look at when they use compensating filter and when they do not use the compensating filter. You get. So let's quickly look at it. And the best filter to use for the axiolateral projection of the hip is what is known as a Ferlic swimmer's filter. Okay, so you can see images. This is where they use the filter, and this is where they do not use the filter. So the filter basically what makes the image much more brighter, you know, so to say, makes the image much more clear, you know. That's the best word to use there. So as a lateral projection of the hip is often used for trauma cases, so the patient cannot move the affected leg, you know.
Another stage.
So it can be performed either without a compensating filter or they now use a filter. So the best filter for this is what is known as what? The Ferlic swimmer's filter. This is the Ferlic swimmer's filter. So this is the image. So what's the challenge? The hip region has uneven tissue thickness. So the thinner areas are near the upper femur and the thicker areas are around the pelvis and the soft tissues. So result, without compensation, the thinner areas may appear overexposed, just like what we have here. Okay. So image quality, contrast and detail can be compromised. So sometimes it might actually even require you taking the imaging again, which is not nice. You know, exposing the patient all over to the radiation is not nice. So with the Ferlic swimmer's filter, this is a wedge. It's also known as a wedge-shaped filter. Okay, so it actually compensates and it now helps to, you know, it's mainly used for hip images and shoulder images. So when you place it, you position it so that the thicker portion of the filter covers the thinner anatomical areas and the thinner portion covers the denser portions. So you now have a balanced exposure to the X-ray light. So therefore you have a brighter image. Okay, I don't know if you understand the jerk. So effects is okay, we've spoken about that. So you have better visualization of the femoral head, the femoral neck and the acetabulum, and you have a very neat image, so there's no need for repeated imagings, you know. So there's also improved diagnostic accuracy where you can be able to now make a decision that is now like very much more valid.